Hi, I'm Dr. Sian Cole, and I'm going to be talking about how we can understand persistent pain through neuroscience. So neuroscience is the study of the nervous system. So we know really that 1 in 4 people will experience persistent pain. It is a very common condition and something that we do need to get much better at teaching people how to understand their pain and therefore how to manage it. So pain is not actually an invisible illness. I think a lot of people think that they are definitely perceived that way, but we understand that pain affects so many different aspects of people's lives. Many patients are really surprised about why they get referred to see a psychologist and sometimes worry that we think that they're making it up, and that's definitely not the case. We understand that pain affects a number of different people in different ways, just like cancer can affect people's whole lives as well. And we don't think people's cancer is in their mind. So some of the main problems here that we see that stop people from being able to manage their pain is that anxiety and other unpleasant emotions often get in the way. I would say probably up to 95% of people with persistent pain will be struggling with anxiety or depression, which is completely understandable. And again, another good reason why seeing a psychologist can be really helpful. Withdrawing from social activities, friends and family, that is a big problem, and you can see how that would affect people's mood as well. Fear of movement. So a lot of people do engage in avoidance of pain, likely due to the belief that their pain is actually showing that more damage is being done to the body. Lack of knowledge about persistent pain and how to treat it, which is why a lot of professionals in this area really recommend getting education about persistent pain is a really first important step. And that's what I'm hoping this video will help people to do. And another really common problem that we see with people with persistent pain is that they're seeking passive treatment. They're just taking medication and resting and kind of waiting for the pain to go away, which kind of keeps them stuck, or instead of seeking active treatment. So I'll talk a little bit about that in a minute as well. So just be kind to yourself in trying to wrap your head around some of this. It can really be difficult to challenge some of those kind of long-held beliefs that we have about pain. So yeah, just be open, and you can always explore more information as well. And I'll link some videos in the comment. And I'll link some videos in the description of this video. So the first thing I want to do is explain the differences between short-term pain and persistent pain. So they are different conditions, really. Look, we've all experienced acute pain. So this is that pain that's less than 3 months. It's related to an injury. So that's why we say it's less than 3 months, because that's the amount of time the body takes to heal. So you can think about a sprained ankle or a broken tooth, things like that. So it will have little impact on work and socialise and limited emotional distress, because we know what's happening and we get better. So the opposite is kind of what's happening for persistent pain. It lasts longer than the body takes to heal, and the pain is not related to body injury. It's actually related to the nervous system, which is what I'm going to talk about a little bit more. It does impact life, as I've said before, in many areas, and it does often create ongoing emotional distress. Now, the treatment for both of these different types of pain is different. So the medical model is completely appropriate for acute pain. So you just let the doctors prescribe the medication or the surgery if required, and you rest. You might ice your ankle, go to the dentist, get that kind of medical treatment. Now, this medical treatment doesn't work, or this medical model, I should say, doesn't actually work for persistent pain. If it did, there would be no such thing as persistent pain. So what we're really interested in is the biopsychosocial model. So looking at people's engagement back in their life Yes, medication and surgery still might be needed. That's the biology side of this model. But we also want to actually help people reduce their emotional distress, the psychology component, and get more engaged in their social roles, the social component. We want people to be active in their role towards getting better, and we can do things like graded exercise and pacing. We don't want people to rest actually too much because that actually can make the pain worse. So I will be doing a video in the future in regards to how to do pacing. So one thing that I definitely really am mindful of when I'm doing this talk with a lot of my clients that I see is that when I'm talking about pain in the brain, I'm not saying that it's in your mind or that you are making it up. So I've kind of made this table to kind of help show the people what I'm talking about and how we see that it is different. So most of this talk, I'm talking about the brain, I'm talking about the central nervous system, like the physical part. Like if you cracked your skull open, you could see it. Where the mind is not a physical thing. It's like the thoughts that our brain actually produces. So mind does matter in healthcare, but when I'm talking about pain, I'm talking about the brain. So this is a picture of some brain cells, nerves, or neurons, whatever you want to call them. I do tend to call them neurons, communicating. So we actually have 100 billion neurons, and each neuron can have like 5 to 200,000 connections. So on average about 7,000. So it's a lot of information being processed and communicated with. It is the most complicated organ that we know of in the universe. So they communicate using chemical transmitters. Neurotransmitters is another word, but they're also known as hormones. So I think people tend to be familiar with the word hormones. So what happens a lot of the time is that our brain gets very good, even sensitive to picking up, the pain in the brain. So I'll explain that a little bit in the next slide. But your brain does everything. So we do know that no brain, no pain. So that's why we do have to pay attention to the brain when we're in pain. So just to kind of really highlight actually how amazing our brain is and actually how it produces our world. This is a checkerboard, and you can see that there's a square with an A on it and a square with a B on it. So I want to ask you, are they the same colour or are they different colours? So we don't tend to really question our visual input, our vision really at all. We kind of take it for as it is. But our brain does a lot of processing outside of our conscious awareness. And I've been looking at this illusion for well over a decade now. And yeah, I definitely see the A square being darker and the B square being lighter. But it is an illusion. You can even print this out and fold it up if you want to, do a screenshot, but they are actually the same colour. What's happening a lot of the time is that our brain, as I said before, is processing information outside of our awareness. It knows that checkerboards have light and dark squares, and it's kind of processing what it thinks makes sense for this. So our brain is quite amazing and does a lot of automatic things. So one way to help kind of understand how our brain kind of gets stuck in persistent pain is a lot of the times we're kind of stuck in this fight-flight cycle. So we're noticing pain, it's a threat, we have a lot of unpleasant emotions associated with that. This releases a lot of those stress hormones or neurotransmitters, which kind of really get pumped around our body, increasing our heart rate and our blood pressure and our muscle tension, maybe creating more unhelpful and scary thoughts, and kind of feeding back into the pain and the threat of it all. So when this is happening, our central nervous system, our brain, is becoming more sensitive. So more of those receptors are being laid down. So where brain is kind of gets a little bit like sunburn, really. It's just super sensitive, even though there's no damage really kind of being done anymore. So what we're really interested in now and what we understand about pain is that we do need to engage in activities, being active, doing graded exposure and exercise, and pacing our activities. And mindfulness is also a really important skill that we use to actually help the brain get into that rest and digest, the parasympathetic nervous system that actually helps reduce pain and suffering and help return the central nervous system to normal. We know that a lot of our pleasant moods, our pleasant emotions are reward. They happen after we've done something, especially if we've done it mindfully and it's something that we really value. And so when our brain notices those pleasant moods, it releases all these other hormones. And these are our feel-good hormones, which are also natural painkillers. So our brain's got the chemistry set. We just need to train the brain to start kind of releasing that. And again, that's why this education is really important.